Hello, lovely. How are you? Good. I'm good, thank you. I'm Dr. Nicola, and I'll be carrying out your checkup today. Nice to meet you. So, before I begin, do you have any concerns at all? Okay, that's good. So, we're just going for a general medical checkup. Perfect. So, I'm just going to check you in if that's okay. Good. So, let me just log on. Okay, so there you are. And if you can just confirm your name for me. Thank you. And your date of birth. Thank you. So, no concerns. Okay. Right, if you wouldn't mind just telling me your height. Thank you. Lovely. And you know what you weigh? Okay, well, if you wouldn't mind just popping on the scales for me, that'd be great. Thank you. So, weight. Wonderful. Okay, if you can come sit back down. Thank you. Wonderful. Nice and healthy weight. Okay, lovely. Have you brought me a urine sample? You have, wonderful. If you wouldn't mind just popping it on the table for me and I'll check it a little bit later. Okay, right, I also have you down for some bloods today, is that right? Wonderful. Okay, I'll do those towards the end of the session as well as the urine sample. Okay, wonderful. Okay. Perfect. So, let's begin. Let me start by having a little listen to your chest, okay? If you can just pull your top down for me, that'll be great. Ready? Okay. Okay, if I can have a listen round the back. Okay, I'll just go around the ear. Your lungs sound nice and clear and your heart sounds nice and strong, okay. I'm going to write some notes and then I will type them up when you're gone. It's a little bit old school, but I quite like that. Okay, so just clear and hold. Okay. Now, if I can have your wrist, I would like to check your pulse. Okay. Wonderful. Let me just check your pulse in your neck. Okay, that's fine. Lovely. That's nice. Everything's fine there. Okay, so I'm going to have a little look in your eyes. If you can just look at my nose, that would be great. Okay. Look straight ahead. Now, with your eyes, just look up. Back. Okay. And look down. Okay. Back. To your left. To the right. And back. Let your eyes adjust. Okay. Okay, now I just want you to follow my light, just with your eyes. Good, well done. I'm going to do it a little bit slower. Okay. Just with your eyes, I want you to look here. Good. Okay. Look at my nose. I want you to tell me how many fingers I pop up. All right. Perfect. Okay. Can you just follow my finger with your eyes? Okay, keep looking at my nose. Okay. Now, I'm not an optician, but I just want to have a little look. What colour is this? And that? And these? Good. Can you tell me what letter that is? Can you read that row? And this one? And that one? And this one? Don't worry if you can't, just try your best. Okay, do you wear glasses normally? You don't? Okay. Right. When did you last have an eye exam? You can't remember. Okay. I would recommend that you have an eye exam, okay, just to, check everything and make sure things are working as they should. Okay, a lot of things have changed in the eye exams than a while ago. Some things are the same, but got a lot better equipment and things like that. And if you can't remember the last time you went, I suggest it's a very long time. So you don't wear glasses. Okay, you seem to read most of that, but towards the end it started to get a little bit, yeah, so I would like you to check that. Now, how's your vision normally? Have you been okay? Okay, so you are finding that you are struggling a little bit. Okay, so reading and things like that. Okay, and some headaches, so some eye strain. Okay, are you at the computer a lot or on your phone, etc.? Yeah, that could be why. Right, so my advice would be to go and find an optician and get yourself booked in for an eye test, okay? And say that you haven't had one for a while, so you would like the full works, okay? And then you can mention to them the kind of things that you've been experiencing and that you've had a doctor check and that I've recommended you have a full assessment. All right. Yeah, I mean, your eyes look nice and clear. They're not bloodshot. They're nice, healthy colour. Your pupils are moving as they should and reacting as they should, so there's no problems there. In a little bit, I will have a look at your tear ducts and your oil ducts, but I do need to pop on some gloves for that, so I'll come back to those. All right, but other than that, it looks fine. Okay. So, that's that. I'm going to check your temperature. I nearly dropped that, but I'm going to check your temperature. I'm going to pop it in your ear. Okay. Check the other one. Pop it in. Okay. And for luck, let's check your forehead. Perfect. Temperature is perfectly fine. Okay, great, lovely. That is that. Now I want to have a look in your ears, okay? Have you been having any problems with your ears? Okay, so struggling maybe to hear a little bit muffledness, popping, ringing. Okay, do you have tinnitus normally? No. Okay, any ear infections over the years? Okay, have you ever had your ears cleaned professionally? Okay, right. Let me have a little look. Does that feel okay? It does seem that you have quite a build-up of wax. It looks quite sticky, quite yellow. Do you find that your ears have been itching a lot? Yeah, could be the build-up. It doesn't appear red, but it's hard to tell with that much blockage. Let me just try and go a little bit deeper. Is that uncomfortable or is it okay? Okay. And can you hear me okay? Good. Is there maybe just certain sounds or something like that? Now there is quite a compaction here. It's very blocked. It could be why you're experiencing those things. Okay, I want to take that out. Did that feel okay? Alright, there's definitely a blockage of earwax that side. Yeah, and I'm wondering if the other side's going to match. Okay, let me have a look. Okay. And I'm going to pop that in now. This is looking pretty similar. This one, however, is slightly bit red. Has this one been itching too? Okay. Maybe it's not an infection or something like that, but no, something like building up here. Same kind of colouring again, very yellowy and sticky. Yeah. Okay. Have you been putting anything in the like oil or anything? Okay, that's good. I mean that can help us free it, but just depends really. Let's pop it a little bit further and see if I can see. I mean, I can't go too deep again, it's a lot covering up. Okay. Alright. and healthy. Good. And okay, so yes. Okay, so you definitely need to come for an ear clean, my love. Yeah, your ears are looking quite compacted. Yeah, I mean, if you just look slightly in your ear, you can see quite a build-up on the edge. Okay, so let me just show you. So this is your ear, well, pretend it's your ear, and here looks a little bit like flaky, a little bit of build-up on the edge. Now you can actually, not this size, but a small Q-tip just to clean here, you know, all around your ear like so. And this section here you can use just to move it away, but I don't recommend shoving it in, okay, because you're pushing it further back. Now, do you use Q-tips? Okay, so that could be your problem, that you're pushing it too far in. Okay, so let me just show you this. So we're shoving that in, pushing it back, and it's compacting all up. Okay, we can clean on the edge just there, here, around here, even on the slight edge, but don't push, just kind of roll it around a little bit, don't go in. Yeah, but use a small Q-tip, not a large one like that. And you'll find that here's looking a little bit inflamed on your right ear, my love. Yeah, here. And obviously it's quite building up, so I can't quite see too much. So we need to get that cleaned. I am wondering if you do have maybe a little bit of an infection developing in that ear, but I can't really see at the moment with the compaction. So I think I could do with getting you in for an ear clean, my love. Okay, so you need the works, don't you? Ear clean to remove build up, and then we can assess then if you do need any antibiotics or anything like that. Suspected ear infection in right ear. Okay, but they both need a full clean. All right, now can you tell me if you can hear this? And this one? Now can you tell me how many times you hear that? Okay, okay, so you can hear that quite well, so that sounds okay. So what I will do, I want you to have an ear clean and a mini hearing test with myself, okay? So obviously it's not going to be a full in-depth proper hearing test, but I want to allow the time so I can obviously check a couple of things first, then have a look, then clean, then I can do a little bit of a hearing test again. So there'll be just different objects that make different types of sounds, and I'll be asking you if you can hear them and how many times and things like that. Okay, so I'd need to book you an appointment to do that, if that's okay. Perfect. So I'll have a look in a little while at when I can get you in. Okay, perfect. Right, so I'm going to pop on some gloves. couple of things I want to do. Until it's warm, I can't get my gloves on properly. We'll get there in a moment. Okay, right, so first thing I want to do is your eyes. So I'm just going to pull down and up, down and up. Okay, it's going to be bright. And again. Okay, that looks fine. No blockage in your tear ducts. Okay. Now I'm going to feel your face. Okay. Just checking for any lumps or bumps. Can't feel anything. Okay, check your sinuses and your glands. Just let me know if you feel any pain. I do like to press all over the face as well to see if there's any muscles that are swollen. Can you close your eyes for me? Feels fine and sounds fine. Okay, can open. That all feel okay. Okay, if you can open your mouth, close it. All feel okay. Can you just chew? Will that feel okay? Perfect. I will bring down your glands actually first, okay. That feel okay. Okay, on your collarbone. On your chest. All good? Perfect. Right, you can open your mouth. Say ah. Pop out your tongue. Curl it back. Okay, relax. Open. I'll pop this in. Say ah. Okay. Now I'm just going to pull your lip down. Okay, look at your cheek. You do have some lesions on the side of your mouth, have you noticed? And here is quite swollen, so I'm wondering if you grind your teeth or clench or something like that. Do you have nightmares at all? Okay, when was the last time you went to the dentist? Can you show me your teeth? Okay, I think you could do with having a check. Yeah, I do. I think you need to have a look. I think your wisdom teeth are struggling to get through. Alright, and you know, maybe the odd chip here and there, possibly from grinding. So yeah, I definitely think you need to book in to the dentist, have a full check. Alright, my love. Yeah, they'll have a feel around your jaw and everything like that, and probably get to open and close and different things. They tend to do different things nowadays. But yeah, I definitely recommend that. They might suggest like a night mouth guard or something. So, dentist. I'm hoping you can get one. I know things are a little bit difficult, but if you could try and get an eye test and a dentist appointment, that would be really good. Alright. I know. Having the full works, aren't we? I know, but we need to make sure everything's working properly, and it seems like you haven't been having a check for quite some time. So, okay. Right, now can I just have a look at your fingers? Can we have a look at your nails? Okay, this one. Okay, can you just squeeze and release? Squeeze and release. Wonderful. Okay, now, have you had any weird sensations through your body? Any aches and pains anywhere? Are you worried about anything at all with your body? Is you feeling all right? Okay, wonderful. Now I'm just going to check your scalp. Just check for any lumps or bumps. Any pain or discomfort? Feels fine to me. All good. Now I'm going to feel around your ears now. How's that? Good. Lovely. Alright as well. Any pain or anything when I was feeling around? Okay, that's wonderful. Glad to hear that. Okay. Now, in a moment, I'm going to have a feel around your tongue, if that's okay. Yes. Okay. So, how is your diet, my love? I know that's quite a blanket statement, but how would you say it is? Okay. Do you exercise? Okay, and what about any alcohol? Okay, and do you smoke or vape? Okay. Do you have a lot of caffeine or? Okay. So you do have quite a good, lifestyle. Yeah, with you, with your diet, what you're eating, your exercising, and different things like that. So you look after yourself that way, but you're letting your health go a little bit, my love. I know you're here for a check, which is really good. So that's the first step of, making sure everything's fine. But ideally, I would like you to see you at least once a year for a health check, and I don't think I've seen you in quite some time. Yeah, and on the records, there was nothing showing up for me, so I don't know whether you went elsewhere when you lived in other places, but I haven't seen you. All right, but you're here now, and that's all that matters. So if we can try and get into a swing of coming in every year for bloods, urine tests and a full health check, that'd be really good. All right, my lovely, thank you very much. So I'm happy with all that. That's fantastic. Okay, so you've got no other concerns with anything like your body. Okay, now what about your mental health, my love? How are you feeling? Okay, so you may be struggling to sleep a little. Okay, bit of insomnia going on, bit of stress. Okay, bit of stress, insomnia. Do you know what's causing that, my love? I know that's quite a silly thing to ask, but is there anything that's triggering you a little bit? Okay, maybe busy at work. Okay, work. Just day-to-day life, things like that. Okay, all right. So, are you feeling any anxiety or any depression? Okay, so maybe a little bit of anxiety, a little bit of depression, maybe, or just low mood. Low mood, you're thinking more so. Okay. Would you like me to pass you over to the mental health team? I know that might sound a little bit scary, but just somebody to have a chat with, and just so they can maybe do you a little mini assessment just to make sure things are okay, and if there's anything they can do to help. Would that be all right? I can do that for you, no problem. So I'll sort that out for you, don't worry. You can go to them, tell them how you're feeling more in depth. Yeah, they've got time to obviously allocate that to talk in depth about your mental health. I mean, I do separate appointments to discuss mental health, but they can be quite more detailed. But in this instance, I'd like you to see somebody just to be assessed, if that's all right. It will be a mental health nurse, my lovely. Okay, just so you can chat with them and see what they think. And I can always prescribe you anything if you need to be prescribed anything. No, I wouldn't say you need to go down the route of psychologist or anything like that, or psychiatrist, but I wouldn't know because I'm not assessing you. That's something that your mental health nurse will be able to help you with. But if you're experiencing low mood, anxiety, a lot of stress and insomnia, there's something not quite right there. But obviously I will be checking your bloods today as well, just in case there's, something going on there. But, we'll get you sorted, my lovely. All right, okay, that's wonderful. So that is that. Now, I like to do a bit of a peak flow, okay, just so I can see. So I don't have you down as asthmatic, but I would like to do a check. So if you can put that in your mouth, really wrap your mouth around, that's it, okay. But I want you to go and give it all. Excellent, okay, I'm going to keep it down, and again. And one more time. Excellent, that's really good, that's fantastic. You've got a wonderful peak flow there, really high marks, so that's good, no concerns with that. Okay, so I'm going to check your blood pressure next. Okay, can I have your arm? Let's pop it in nicely. Okay. That's it, looks good. Just relax. Go tight. If I can have your other wrist. Excellent. Okay. That is perfect. And matches. Would help actually turned it off, wouldn't it? So it matches the pulse as well, which is wonderful. Right, so I'm going to do some bloods. Okay, so I'm going to get you to go like this for me. Now I'm going to do quite a lot of bloods, okay? Quite a few I want to test. Okay. Okay. I'll do a plus one here. Okay. Alright, let me have a feel. What do you like with blood normally? This one. Okay, I'm going to use this one. Keep a nice fist, just keep pumping for me. This is just going to clean. Okay. Okay. Wonderful. Okay. You ready? Okay, just hold the fist nice and still now. Okay. Sharp scratch, alright. Wonderful, keep nice and still now. Okay. You're doing really well, well done. Okay. And last one, my love, okay. Wonderful. Okay, in a moment I'm going to take that out, and there we go. Just hold that on there for you. Is that okay? Do you feel dizzy or anything? You feel alright? Good. Because I did take quite a lot then. You're alright. Good. Now if you just press down there for me nicely, thank you very much. Okay. Okay. Lovely. Lovely. That's stopped bleeding, so I'm going to pop on a plaster for you. If I can get into them. Okay. Okay. That feel nice and secure? Okay, perfect. Right, so let me just move this, and do that. So I'll check your earring, and then I'm just going to fill out that. Okay. So, what time did you do this? Okay. Okay, let that do its magic. Okay, so when I've tested that, I'm going to write some notes. I'm going to tick off your blood form, and then I'm going to book you in with the mental health nurse, okay? Looks perfectly fine, my love, nice and clean. Fantastic. Alright. Okay, perfect. So, blood form, bear with me. Okay. 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 Okay, that's that. Okay. Right, I will have a feel around your tummy as well in a moment. Okay, I could just have a little feel. Okay. Any problems at all with your belly? Are you passing water okay? And what about stool? Okay. Any pain or discomfort anywhere? Okay, if you just cough, and again. Okay, can't feel anything abnormal. Okay, that's all good. Thank you very much. Top down. Okay. Okay, wonderful. So, let's pop your name on here. And then okay, my signature. Right, so bloods. Is there anything in particular you would like me to check, my love? I can add that on. Any particular reason? Okay, might as well. Anything else? I'm going to do that anyway. Okay, you're not sure on anything else? Okay, it's fine. On there, that one. Perfect. That's that and that. Right. I am happy with that. So let me book you in for an ear clean, okay? Okay, when can you do, my love? Let me have a look. What about 2 weeks' time? Yeah, I can do that day, but let me just check on the time. Is 9 okay? Perfect, I'll pop you in there. So that is going to be for an ear clean and a bit of a hearing test. Okay. Okay, that's that done. Right, if you could book a dentist and an eye appointment, that would be really good. And I can always see you for a catch-up at some point then if we need to discuss anything. Okay, and I will just pop a note through to the medical secretary, just say that you're wanting a referral from a mental health nurse. Okay, and reason. Insomnia, anxiety, mood, and okay, that's fine. We can sort that out for you. Right, I think we've done everything. Are you happy with everything? Okay, again, I know I've done a lot, you know, a lot of questions, a lot of things I needed to do, and a lot of things I've asked you to do, so I hope everything's all right with that. Any problems, please just, you know, contact me and I'll do my best to, you know, help you. Any problems with the bloods, you will get an appointment. Okay, my lovely, and I will see you in a couple of weeks for an ear clean. In that meantime, if you can book a dentist appointment and book an eye exam, and then obviously hopefully would have heard something from a mental health nurse as well. Okay, you are very, very welcome, lovely. It was a pleasure meeting you, and I wish you well. You take care now. Bye bye.